A shoulder dislocation essentially means that the ball of your upper arm bone, or the humerus, has come out of its normal position in the shoulder socket. The shoulder joint is shaped similar to a golf ball sitting in a tee, which allows it to move in many different directions with ease, but this is also what makes the shoulder easier to pop out of place compared to other joints. When it dislocates, the tissues that normally hold it in place, like the surrounding ligaments, tendons, and muscles, can stretch and potentially tear, which is what causes the pain.
There are a few variations of shoulder dislocations. Inlocated refers to a joint in its normal position. Anterior dislocations are the most common. This occurs when the humeral head moves forward from trauma. Posterior dislocations occur when the humeral head moves backwards, often due to seizures. Inferior dislocations are rare and occur from significant trauma.
Shoulder dislocations can present in various ways. They typically present with sharp pain, guarding, and a classic squared off contour. Most dislocations are anterior dislocations, with the arm slightly abducted and externally rotated. Posterior dislocations present with the arm adducted and internally rotated with a loss of external rotation. And inferior dislocations, while rare, would occur with the arm being locked overhead. After direction is suspected and confirmed, typically you'll check the axillary nerve sensation over the deltoid and distal pulses.
The most common complications and progressions to a shoulder dislocation are going to be chronic instability due to the ligamentous damage that happens when you dislocate your shoulder. But complications such as soft tissue damage to the labrum and the surrounding ligaments, as well as Hill-Sachs and Bankart lesions and rotator cuff issues, are not uncommon as well.
There are some red flags that an individual should be aware of that could indicate a more serious condition or emergency situation. These include visible deformity, inability to move the arm or limited range of motion, absent or weak pulse, coolness or pale color, severe swelling or bruising, numbness, tingling, or weakness.
Two differential diagnoses for shoulder dislocation, one being the AC joint separation. This one would have a bump going up from the clavicle, separating from the acromion, and then the shoulder dislocation would be going down due to the humerus coming out of the socket. And then a rotator cuff tear, there would be no visual differences on injury because it is a deep injury. And then a shoulder dislocation would have, again, the sulcus sign, the little divot where the humerus came out of the socket.
The immediate actions that need to be taken for a shoulder dislocation are to number one, stop the activity. If they're in a sport or something, make sure that they don't return to play and no unnecessary movements. Number two, assess for neurovascular compromise. This could look like palpating the radial pulse, doing a capillary refill, and checking the skin for changes in color and temperature. Number three, immobilize the joint. This can be done with a sling. And number four, provide analgesia. So this could be ice or ibuprofen, anything to help ease the pain of the person with a dislocated shoulder. And then referrals, if this is the first time that it happened, it would be to the emergency department. But if this is a reoccurring issue, then it would be to the orthopedic surgeon.